You can think of Neuropad in the same way as using a canary in a coal mine. It detects early signs of foot problems, which can then be confirmed with further tests, which allows early identification and, of course, treatment. Now, Neuropad resembles a sticking plaster, but with a blue pad in the centre. You stick one on the sole of each foot, like this. You then wait for 10 minutes for the test to complete. And then you look at the colour. It's simple and painless, and the test can be done at home. If you can put a plaster on the sole of your foot or someone else's, you can use your Neuropad. The test is also easy to interpret. If the central blue pad changes to pink, then that's a potentially good sign. But if it doesn't, you should consult a member of your or your loved one's healthcare team to discuss the results. Now, whatever the results, you should always let your doctor know what that result is. For more information about Neuropad and the published clinical evidence supporting it, please visit neuropad.co.uk.